Up to now, we have seen two units, and these two units they majorly contains the bacterial diseases which are caused to different organs of a host. And in that we have seen typhoid, cholera, then later on staphylococcal infections, diphtheria, pulmonary tuberculosis, and lastly syphilis disease. Now, in concern to the third unit, which mainly contains those diseases which are caused by viruses. And in this third unit, the viral diseases mostly caused by the viruses, this includes hepatitis A and B, and second one is the AIDS. So in third unit, we are going to study these two viral infections. Now in that, we will see in this class the hepatitis A. Just so in this class, we are going to study the viral diseases, and these viral diseases they are the two types of diseases, AIDS and the hepatitis A and B. Now firstly we will see the hepatitis A and B disease, and these diseases they are the diseases primarily of liver of human beings, and these hepatitis diseases they are caused by a group of viruses, that viruses known as viral hepatitis. And this group of virus contains various types: hepatitis A, B, C, D, E, and G. And this is a heterogeneous group which is mostly affecting the liver of human being. And this group of viruses they are taxonomically unrelated, means they are not having any similar characters in them. But here the type hepatitis B virus, it is containing DNA as a genetic material, while the rest of the other groups of members of this hepatitis viruses, it includes RNA as a genetic material. And all this group of viruses they are having a common feature. That feature is known as a hepatotropism. Hepatotropism is these viruses they are having particular affinity towards the liver of human beings, particularly to the human beings liver only. So that's term hepatotropism, it gives meaning that it are these viruses, this group of viruses they are having affinity towards the cells of liver. And now this group of viruses they causes illness similar to that of jaundice type. And that illness which is caused by this group of viruses, it ranges in severity from an apparent to a fatal form. Means some of these viruses they causes unapparent infections, means we are not able to detect which infection is there. A symptomatic type of infection is there. But some of these group of some of the member of these viruses they causes fulminant fatal form of diseases, means we can easily know which type of infection is that. Now you know that when a person is suffering from a jaundice, then particular characters they are shown there. Such type of characters, these characters they are fatal form of characters. But some of the diseases which are caused by this group, they are asymptomatic. Means we are not able to detect which virus is there and which type of infection is there. Now depending upon the epidemiology and clinical criteria, there are two types of hepatitis viruses recognized. There are two types of viral hepatitis they have been recognized. First type, it occurs sporadically or as epidemic, means at a particular location there is a presence of this type of infection that we call epidemics. And this group of viruses they are mostly affecting the children and young adults. And this group of viruses they are transmitted from source to the healthy person by fecal oral route. They are transmitted through the fecal oral route. And this group of viruses which are causing this type of infections, they are known as infective hepatitis or infectious hepatitis. So, on the basis of epidemiology and clinical characteristics, there are two group of hepatitis viruses are there. First group which causes sporadic or epidemics, mostly affecting the young children and young adults. Here, the transmission of virus is from source to healthy person by fecal oral route. So they are spread rapidly, and because of that, this group of viruses they are known as infective or infectious hepatitis. Then second group of viruses, viral hepatitis is transmitted mainly by inoculation. Here, second group of viruses, hepatitis viruses, they are mainly transmitted by inoculation mode, which was originally observed in persons which are receiving serum or blood. Some persons they require due to some reasons they require given these persons they are given artificially serum and the blood. And in such conditions, if these blood samples or serum samples they have been not properly screened, then sometimes it may happen that sample may contain the hepatitis virus. And such a spread of hepatitis virus through the inoculation mode, they have been called as a transfusion hepatitis, homologous serum jaundice, or serum hepatitis. Because the mode of transmission here is the inoculation of serum. If that serum sample it is contaminated with hepatitis B virus, then such type of transmission of hepatitis virus and the cause of this disease is known as a transfusion hepatitis or serum hepatitis. So there are two groups of hepatitis viruses are there which are causing sporadic affecting young ones, childs. We call this group of viruses, hepatitis viruses, as infectious hepatitis. And those group of viruses which are transferred mainly because of the blood samples or the serum samples through the inoculation mode, such group of hepatitis viruses, they are known as a transfusion hepatitis. And the infection which transfer, that we call it as a transfusion hepatitis or serum hepatitis. And this serum hepatitis or transfusion hepatitis, it is later on known as type B type of hepatitis. So firstly we will see the type A hepatitis. This type A hepatitis, which is known by another name, that is infectious hepatitis, it is a subacute disease of global distribution and mainly affecting the children and young adults. So this type A hepatitis, it mainly causes subacute type of diseases, which is not a dangerous type of infection, and it is affecting the whole world. So that's why it is known as a global distribution, and it mainly affects the children and young ones. So firstly we see the etiology of this hepatitis A virus. In 1973, scientist Finstone and co-workers, they use a technique. That technique is known as immunoelectron microscopy. And by using this immunoelectron microscopy, they firstly demonstrated the presence of a virus in the fecal matter of experimentally infected human volunteers. These are the scientists who firstly demonstrated the presence of hepatitis A virus in the fecal matter of experimentally infected human volunteers. They also shown that the chimpanzees and marmosets, it is a type of monkey, which can be infected experimentally with the help of hepatitis A virus. So, firstly, this virus is detected in the human beings, which are acted as volunteers during the study. Later on, it was discovered that this virus can be transmitted in artificial mode to the chimpanzees and marmosets. These are the monkeys, where we can artificially infect them with the help of this hepatitis A type of virus. Now this hepatitis A type of virus, it can be grown in some of the human and simian cell cultures, and is the only human hepatitis virus which can be cultivated in vitro. While the rest of viruses, whether it is type B, type C, type E, type F and type T, these viruses, they are not cultivated in laboratories. But the only virus which is cultivated in laboratory is a hepatitis A type of virus, which is cultivated in laboratories in the cell lines, in human cell lines or in simian cultures cell lines. So we can grow this hepatitis A type of virus in our laboratories with the help of cell line cultures. Now this virus, it can be also cloned. Cloning of this virus can be made. Now this hepatitis A virus, it is having size 27 nanometer. It is non-enveloped RNA virus which belongs to the family picornavirus family. But earlierly, it was originally it is designated as enterovirus 72, and because of its unique feature, this hepatitis A virus is now recognized as a prototype of a new genus, hepatovirus. So earlier this virus, it is designated as enterovirus 72, but later on, because of its characteristics which are shown by these viruses, they are recognized as a prototype of new genus of hepatovirus, and only one serotype of this virus is known, of hepatitis A virus. Now this hepatitis A virus, it is resistant to inactivation by heat at 60 degrees Celsius temperature for 1 hour. If we heat any object with up to 60 degrees Celsius temperature for 1 hour, if that object contains this virus, then this virus is not inactivated. It remains there. It remains undestructed there. It also affected by ether and acid at pH It is not affected. It is resistant to this ether and acid at pH 3. But it is inactivated by boiling for 1 minute. As you know that boiling water, it has a temperature near about 100 degrees Celsius temperature. So in such condition, this virus can be easily inactivated. Similarly, we can inactivate this virus by treating this virus with formaldehyde at 37 degrees Celsius temperature for 72 hours by using a concentration of formaldehyde 1:4000. In such concentration, we can inactivate this virus, but the time required for this inactivation, it is 72 hours. While when we use chlorine, 1 ppm, 1 ppm chlorine is sufficient to inactivate this virus within 30 minutes. Within 30 minutes, this virus can be easily inactivated with the 1 ppm chlorine. Now this virus, hepatitis A virus, it is not affected by anionic detergents. It is not affected. It remains there. In intact condition, it remains there when we treat that with anionic detergents. Now this virus can survive prolonged storage at temperature 4 degrees Celsius temperature or below for longer duration. So we can store this virus for longer duration at 4 degrees Celsius temperature or below that. You can do this. This is the hepatitis virus. This is the envelope. And in that envelope, there is a presence of a RNA as a genetic material. So this is the hepatitis A virus which causes the infectious type of hepatitis in children and young adults. This is the photograph, electron microscopy photograph of this hepatitis A virus. This group is the group of hepatitis A virus group. Then the next is the epidemiology and the pathogenesis of the type A hepatitis. The infection, hepatitis A type of infection, only occurs naturally in the human beings only. There is no other source is there. This hepatitis A type of hepatitis, it only occurs in the human beings, not any other eukaryotic organisms, not any other animals. It only occurs in the human beings naturally, but artificially we can infect chimpanzees, which can acquire infection from humans, and that chimpanzee then can transfer this infection to human contacts again. Okay, so hepatitis A type of infection only occurs in the human beings naturally, but artificially we can infect chimpanzees and marmosets. This is another kind of monkey which can be artificially infected with hepatitis A type of viruses. But when we infect these animals then can act as a source and transfer this infection to human beings. And from human beings, it can transfer to infections to the human beings. So there is no extra human source of this virus is there. This hepatitis A type of virus only affects the human beings. No other source is there to which it can causes the hepatitis A type of infection. Now, the transmission of this virus, it is mainly taken place through fecal oral route. And fecal oral route means here when we drink contaminated water, those water which are contaminated with hepatitis A type of virus, then it can become a source and it can be transferred through the fecal oral route. And this infection to the healthy person, it is acquired by ingestion mode. So This ingestion mode is the mode through which this infection can be acquired by a healthy person. And the source of infections, they are the contaminated food, water. So these are the main important source which act as a source of this hepatitis A type of virus. And this A type of virus, it is acquired by the healthy person through ingestion mode. Now when this virus enters inside the host, this virus multiplies in the intestinal epithelial cells, and from that it reaches to the liver by hematogenous spread, means the cells which are present in the liver. By using these cells, this virus can spread to the liver throughout the cells of the liver. And from that, this virus, it can be given into the fecal matter during the late incubation period and prodromal phase of illness. So it reaches the intestine. From that intestine, it enters the liver cells, and from these liver cells, this virus is ultimately given in the fecal matter. It is ultimately given out in the fecal matter, and this happens during the late incubation period or prodromal phase of illness of hepatitis A type. Now the prodromal phase of this hepatitis A type of infection, it is characterized by marked loss of appetite, as that person is not having affection towards the eating process. Then other symptoms which are shown there, they are flu-like symptoms are there, low-grade fever, nausea, vomiting, and these symptoms, they last for few days. And this type of symptoms, they are when this type of symptoms they are shown, this phase of infection, it is known as a prodromal type of phase. Once this phase is over, then there is an onset of jaundice. And in this condition, it is rarely detectable in the feces. When jaundice develops in that person, then this virus cannot be detected. It cannot be detected in the fecal matter very easily. Now in this case, the chronic carriers not observed, means such persons which give out this virus for longer duration, such carriers we call it as chronic carriers. Such carriers, they are not observed in case of hepatitis A type of infection. And this virus is persistent in the nature, which depends upon the inapparent infections. So this virus can cause inapparent infections in the children and the young ones. So that's why it remains in the natural condition, natural environment. And whenever it gets the opportunity to infect, it infects the young and children. You can see here, this is the cycle. If we take this by ingestion mode, contaminated water, food which contains this virus. This is the ingestion process. It affects the liver cell. It multiplies there. And then it is given out in the gallbladder, through which it can be given into the fecal matter. It is again transferred to the blood. Then it is given out into fecal matter. Same cycle continues. So it begins with drinking of or ingestion process of contaminated food and water which contains this virus through the ingestion mode. Then it affects the liver. Then it again given out into the fecal matter by that person. So this hepatitis A type of infection, it occurs in 3 phases. Prodromal phase. This prodromal phase, it lasts for a week after the beginning of this infection of hepatitis A type. The first phase is the prodromal phase, which lasts for a week, and this phase is characterized by fever, loss of appetite, fatigue, abdominal pain, nausea, vomiting, and dark colored urine. Then the next phase is the eccentric phase, which is nothing but the clinical jaundice. Those symptoms which are shown in the jaundice, they are developed there. And this lasts for near about 1 to 4 weeks. In eccentric phase, there is a liver enlargement is there. And that liver, it is also showing tenderness. This is the characteristic of eccentric phase. Then the last phase is the recovery phase. The patient starts improving in 1 to 3 weeks after the onset of the jaundice. Fever improves after 5 to 7 days of jaundice, and full recovery takes place around 4 to 6 weeks. So these are the 3 phases which are shown in hepatitis A type of infection. First is a prodromal, or which is also known as a pre-eccentric phase. Second is the eccentric phase, and the last one is the recovery phase. These 3 phases, they are observed in a hepatitis A type of infection. Now, during the phase, there is a brief viremia is there in the pre-eccentric phase. Means in case of prodromal phase, there is a brief viremia is there. Means this virus enters the blood, and this condition, it is known as a viremic condition. But this viremia, it get decreased once the jaundice or the eccentric phase begins, and this chromoviremia doesn't occur. In this case, chromoviremia doesn't occur. Here the parental transmission is very rare. Infection hasn't been reported. Infection of this hepatitis A type, hepatitis A type of infection has been reported in the recipient of some clotting factor concentrates. Some persons, when they are given some clotting factors, in such persons the hepatitis A type of infections, they have been reported. Transplacental infection of this hepatitis A virus hasn't been documented yet. Means from pregnant woman to her child, such type of infection, that is known as a transplacental infection, hasn't been documented yet. This hepatitis A virus may be present occasionally in saliva and the urine of that patient, but these are not considered in its spread. The only source through which this virus is transferred, it is transferred only through the contaminated water and food, and that is through fecal oral route. Now this hepatitis A type of virus occurs sporadically, which may be caused by contaminated food, water, milk. And those persons which are having interest in eating fishes, particularly shellfish. This shellfish has been known to be responsible for outbreaks of hepatitis A type of infection. And domestic and institutional spread of infection among the children is also a common fact. And overcrowding, poor sanitation condition favors the spread of hepatitis A type of infection. So this is all about the pathogenesis and epidemiology of the hepatitis A type of infection. So causes of the hepatitis A, they are the contaminated food, water, and here is also sanitation condition is also important here. So these are the main 3 sources, and through which this hepatitis A type of infection may be begun. Now, in developing countries such as like the India, infection is acquired in the childhood, like that of polio. And by the age of 10, 90% of the population possesses antibodies against the virus of hepatitis B A virus. Against the hepatitis A virus, 90% of the population in the developing countries, they get the antibodies against this virus and they become immune. In India, type A hepatitis is most common cause of acute hepatitis in children, but is much less frequent in adults. So in case of India, type A hepatitis is the most common cause of acute hepatitis in children, but it is not that much serious in case of adults. Mostly this infection affecting the children in the Indian region. So next is the clinical features of this hepatitis A type of infection. Here in this case, large majority of the infections caused by this hepatitis A virus, they are the asymptomatic ones. Means in these childs, any kind of symptoms they are not shown, but only about 5% of the children they shows the illness. In that, the apparent illness they are shown. And here, the incubation period of this virus is about 2 to 6 weeks. And the clinical disease of this hepatitis A type, it is of two stages. It consists of two stages, prodromal or pre-ascitic or ascitic stage, second. And the onset of this disease, it is acute, insidious, showing fever, malaise, anorexia, nausea, vomiting, liver tenderness, and these usually get hidden when there is an onset of the jaundice, that is the ascitic phase of the illness. When it begins, these symptoms they are not shown there. Now in this case, the recovery from this infection caused by the hepatitis A virus is very slow. Over a period of 4 to 6 weeks, this much amount is required to recover from this infection in a natural condition. And in very rare condition, it becomes fatal. It becomes fatal fulminant hepatitis. As you know that only 5% of the infected one get the clinical symptoms, means they are affected by hepatitis A virus, which are showing symptoms. Clinical appearance is there, but the remaining 95% they are having this infection in an inapparent form. So naturally they get recovered after 4 to 6 weeks, and fatal disease will be developed in only about 5%. This disease is milder in children, in whom many infections they may be uncentric. Here, mortality due to this hepatitis A virus is about very low, having 0.1 to 1%. And with most of the death which are occurred because of the hepatitis A type, it is occurred in the adults only. So these are the clinical features which are shown by this hepatitis A type of infection. You can see here these most common symptoms which are affected. It is affected because of the malfunctioning or defective functioning of this liver. There is a yellowing of skin, yellow eyes is there, pain in abdomen, joint and muscles, diarrhea, dark urine, pale stool, fever or high temperature, vomiting, nausea, and fatigue. These are the symptoms which are shown in case of hepatitis A type of infection, which is caused by the hepatitis A type of virus. Then the laboratory diagnosis. In this case, the laboratory diagnosis of this hepatitis A type of infection, it is made by two different methods. First is the demonstration of this virus. Second is the demonstration of antibodies in the samples which are taken from the patients. Firstly, the demonstration of virus, it is carried out by using immunoelectron microscopy. And this immunoelectron microscopy, it is carried out by using the sample, that is a fecal sample from that patient. And this fecal sample, it is collected during the late incubation period and the pre-ascitic phase. But in the latter condition, we are not able to detect the presence of this virus in the fecal matter. And this hepatitis A virus tests, they are not widely available and useful in the practice. Means this virus cannot be easily detected by using this immunoelectron microscopy. And such practices, they are not available for this hepatitis A type of virus. Here, the second method is the detection of presence of antibodies. Here, in this case, two types of antibodies, they have been developed. IgM, anti-HAV virus antibodies. This appears during the late incubation period, and the highest peak of this antibody, it is observed in 2 to 3 weeks, and then later on it disappears in 3 to 4 months. Second type of antibody which is developed there, that is IgG antibody. It appears at the same time, it peaks in 3 to 4 months, and this antibody, IgG antibody, it persists there for longer period, or perhaps for the life of that person. Now the demonstration of these two antibodies can be useful for the diagnosis process. So the firstly, demonstration of IgM antibody in the serum indicates if we observe this type of antibody, particularly against the hepatitis A virus. When we observe such antibodies in this serum sample of that patient, we can say that, which indicates that there is a current or reinfection of this virus is there. If we detect IgG antibody, it denotes that there is a recent or remote infection or immunity is there. So, special type of ELISA kits are available for the detection of IgM and IgG antibodies against the hepatitis A virus. So, basically there are two types of methods are available in order to laboratory diagnose the hepatitis A type of virus. First is the demonstration by using immunoelectron microscopy, not immunoelectrophoresis. Second is the demonstration of the presence of these two type of antibodies, IgM and IgG antibodies. So this helps in order to diagnose this type of infections in the patients. Then the prophylaxis. How to avoid this infection? How to avoid this hepatitis A type of infection? This can be avoided. By using improved sanitation practices. Secondly, prevention of fecal contamination of food and water. So when we properly do these two types of stages, then it minimizes the risk of this hepatitis A type of infection. Secondly, some specific passive prophylaxis methods are available where we use pooled normal human immunoglobulin where we can extract these antibodies from persons which are affected by this virus and use as a prophylactic measures. Here 16% solution in a dose of zero point 0.1 to 0.1.2 milligram ml per kg body weight. This much amount of antibodies they are given before exposure or in the early incubation period. When such amount of this pooled human immunoglobulins they have been used in early cases in early incubation period or before exposure, it can help to prevent or attenuate the clinical illness. It can prevent and attenuate the clinical illness caused by this hepatitis A virus. While it is not necessary to prevent infection or virus excretion. This virus excretion, it cannot be prevented. There are no such drugs are there which are effective against this virus. So when that person is infected, it cannot be treated that by using some of the antiviral drugs. Here some of the vaccinations they have been carried out, such as safe and effective formalin inactivated alum conjugated vaccine containing this hepatitis A type of virus which is grown in human diploid cells. Human diploid cell culture, these are available as a vaccine against this hepatitis A type of virus. And here a full course of 2 intramuscular injection. This vaccine is given in the form of injection dose. 2 intramuscular injections of this vaccine. It gives protection. That protection begins within the 4 weeks after the injection of this vaccine, and it may last for 10 to 20 years. So when we use this vaccine, then it gives protection against this infection for near about 10 to 20 years. And you know that natural infection with this virus, hepatitis A virus, clinical, subclinical infections leads to the lifelong immunity. It leads to the lifelong immunity in that childs or adults. There is no cross immunity observed between the hepatitis A virus and other type of hepatitis viruses. Means the immunity which is developed against hepatitis A virus, it only acts against this virus. This type of immunity, it is not acting against the hepatitis B type of viruses. Here, this immunity only lasts against the hepatitis A virus only. There is no cross immunities there. Means that once the immunity is developed in childs against the hepatitis A virus, it is not effective against the hepatitis B type of virus. So there is no cross immunities there. So in order to avoid this hepatitis A type of infection, 2 type of conditions we can use. First, use improved sanitation conditions, avoid contamination of food and water with fecal contaminated with that is hepatitis A type of virus. Second, use of vaccines which are cultivated in human diploid cell cultures, and these 2 measures helps to avoid the hepatitis A type of infection. This is the vaccine which can be used in 2 doses which are given in intramuscular, and it gives protection to those persons which are injected with this vaccine for 10 to 20 years. Here, treatment against this hepatitis A type of infection, no proper treatment is available. The treatment depends upon the symptoms. What kind of symptoms that persons or that child shows, accordingly that child is treated with some kinds of medicine. But no specific antiviral drugs are available against this hepatitis A type of virus. So in order to avoid this infection, vaccination is must there. Vaccination against this virus is the must one because no specific kind of antiviral drugs are available in order to treat that childs or young ones which are infected with hepatitis A type of virus. In this case, we are going to treat that childs according to the symptoms which are shown. No specific antiviral drugs are available against this infection. So,